Why the company is important? I mean, they've been the first to create, to design this kind of technology. 15 years of experience are leading to an excellent know-how. We are now at the 5th generation of this laser, and we are at the 3rd generation of fibers. The protocols are standardized and personalized. We have 2 different kinds of fibers, radial and linear. Competitors have only one kind of fiber. And the company is providing training courses, international events for experience exchange. So having a solid experience and a solid company behind it is actually very important. Next one. I said before we have 2 targets, like lipolysis, fat for lipolysis, and water, that means skin tightening, skin stimulation, skin rejuvenation. Next one. One click. We have basically 3 actions. Lipolysis. It means that we can remove fat. So I don't like to call it really lipolysis, I prefer to call it ablation. This is the first step of the procedure that is still pure surgical, where we apply the energy, we remove fat permanently, like we cut the tissue and we remove it. So this is a very precise first step, where we decide, we map the areas that we should develop, and we work focusing, targeting those little areas where we should remove volume. So if we compare with what we saw before, this is just the opposite, it's the negative. He is producing volume, he is producing mechanical support. We remove volume, we sculpt, we make a contouring of the face, creating shadow instead of creating light. So it's a negative filter. You have to think of this procedure in this way. Next one. Second step, once we remove what is not necessary or what we don't like, we start with the second step of the procedure that we do in the same session, of course, and we contract the subcutaneous epithelial network in order to obtain a repositioning of the skin that is attracted to the muscle. So it's not a vertical lifting, it's a centripetal contraction. It's a downsizing effect. Third step, we stimulate the dermis, we stimulate the skin, we stimulate the subcutaneous layer. We have evidence, scientific evidence of collagen production enhancement and elastin production enhancement, but also improvement in the quality of the tissue architecture. Next one. So as I said before, once we insert the microfiber under the skin, we get a contraction, a 3D contraction. And actually this is very important because as we are not lifting, if we want to remove, or we want to sculpt the jawline, we should not work on the cheeks, but we should work directly on the jawline, removing the excess of volume that we don't like in this area. Next one. We have specific thermal targets. 42 degrees for collagen stimulation through activation of digital proteins. Reversible protein denaturation, that means collagen shrinkage, over 43 up to 60 degrees, and lipolysis from 55 to 70. This is a very narrow range of temperature because with this laser we have to avoid to exceed this range of temperature, because this leads, next one click more, this leads to not only no results but tissue damage that can be permanent. Once you remove a fat compartment, you won't get it back. So it's very important that when you do the liposculpture, you treat only those fat compartments that during the aging process might undergo hypertrophy. never treat the fat compartments that undergo hypertrophy during the aging process, because those are the most precious and we have to save them. Next one. So different targets of temperature, thermostimulation 42, as we said before, means that we have different settings. No, it was okay. It was okay. Go. It was from there, so I stayed there. Easier. Okay. And to target different range of temperature, we have standardized settings that allow us to control the amount of energy I'm delivering and the temperature that I'm reaching. But also, in this slide, you see which fiber we recommend in order to better control the temperature. Because if the matter is being able to control the temperature that I am developing, the fiber allow us to have a better control of the effect, because the different emission is giving a different behavior of the temperature. I'm not lucky today with technology. We had the same problem the whole day. Anyway.
انا بدخل جوه كده انا في الكورنر تعالى واتنشط. ايوه رجاء قالت بنات بس
تعرفوا على مين؟
تعرفوا
هم نفس التيم متغيرين.
Okay.
رجاء بتقول لي مش الدكاتره
No.
هتقدر
Go back.
عشان بنات
Back.
الدكاتره كلهم اللي في المكان
Back.
انا قلت لهم حتى هاتوني طيب
هاتوني ده راح
برضه مش عارف ايه السبب
نفس الاستراحه اللي
Go back.
هم كوميونتي برضه عليا
Okay. So, as I said, no, leave it.
بس مش هديكوا فلوس
This one. So,
تاكل من اللحم لكن ما تاكلش فلوس
standardized settings and suggested fiber. Why suggested? Because that is the operator that can select linear or radial depending from manual skillness or experience, but actually the recommendation is that with certain fibers, with a particular kind of fiber, you can achieve better some effects, and with other fibers, you obtain other effects. And that's what we will see. Next one. Next. This is the latest publication where, through histologies, we finally demonstrate that we have not only an increase of collagen type 3 and elastin production, but also we establish that the relationship between energy emission and collagen and rejuvenative process is not linear. What does it mean? It means that once we increase the energy, we increase the result, but at one point, increasing the temp, increasing the energy, we reduce the effect. Next slide. And we can see very clearly from this table. At 5 joules per square centimeter, we have more collagen comparing to 20 and 40. But not only this, dermal thickness improves at 20, but reduces or is not evident at 40 joules per square centimeter. And next slide. What is even more interesting, next slide. The architecture and the quality of the tissue is maximum at 20 joules per square centimeter, while it's completely damaged at 40 joules per square centimeter. And the pathologists that analyzed these histologies told me the skin, the tissue looked in that skin with 40 joules per square centimeter looked like a 90 years old woman. So really, you can damage permanently the tissue. Next one. But the important thing is actually that we can regenerate. So endolift is not only a lifting procedure, but has to be considered as a regenerative procedure. We have 3 parameters that should be set in the machine. It's a pulsed emission, so we have a duty cycle made by time of emission and time of cooling. It's a pulse, I mean, it's not an emission, not emit energy that give us cooling time. And what? That is the measure of the intensity. Sometimes it's hard to explain how you deal with T-on and T-off. So an example is like, imagine you have a mixer tap and you select with T-on and T-off the temperature, and opening and closing, if that is the intensity, the watts, is how you modulate the amount of energy. But T-on, T-off is the one who is giving you the clinical effect of this procedure. And I give you some parameters. One click. They forgot me. No, go back. Go back. So, we need at least 25 milliseconds in the duty cycle to start with stimulation in the tissue. At around 40 milliseconds, we start to contract collagen. And over 50, we start to obtain lipolysis. It's clear that in the way we set the machine, we can select, if working only for skin quality, subcutaneous contraction or lipolysis. Why is it this important? Because of course, if you are treating a skinny person with no fat, you should be able to stimulate and lift without lipolysis. So our range of setting will be here. If I have a fat neck, I must work here to remove fat. And then I can switch for only rotation or stimulation after I remove the fat. So in this way, I'm able to select the action that I want to develop in order to perform the best procedure and obtain the best result. Next one. The fiber is the most precious tool in this procedure. As I said before, it's a tool that allows us to carry the energy directly in contact with the tissue, obtaining very good results with minimal amount of energy. This is the latest generation of fiber, the ELX. It's just one fiber without any other connection. And this fiber enhances 20% the efficacy of the procedure, reducing even more the side effects. Next one. 2 different emissions we have, radial and linear. Which is the difference? The difference is that we have a concentrated energy here in a very narrow area with a very high density. This means that we have a sharp tool in our hands, like a needle or a cannula. Sharp tip, blunt tip. And not only this, with the radial emission, we have the same amount of energy distributed in a larger area and change the density of the energy. We're going to have an increase of temperature that is very smooth and more controlled, which is the benefit of this. Next one. Next one. If this is a subcutaneous tissue, here is the fat, here is the dermis, there is the mass. I have my fiber that is emitting the laser radiation, and this is how the temperature behaves in these settings: 2.5 watt, 25 milliseconds of T-on and 50 milliseconds of T-off. After 1 second, we have plus 35 degrees. After 2 seconds, plus 38, plus 40, plus 45 in 4 seconds. But this linear emission allows us to have a cold tissue at the sides. Is it good? Yes, it is, of course, because when I am in areas where I have nodal structures like nerves or arteries underneath, in this way, I can be safer, I can be very selective on the tissue that I want to approach. Next one. Next one. It's different with the radial fiber. First of all, as the density of the energy is completely different, the increase of temperature is more under control. So I have on the sides, I have nothing in the center, but on the sides, I have this behavior of the temperature. And you see that the increase is not 25, 35, 40, but it's 4, 6, 8, 10. Why is this important? This is important because if for skin stimulation we need 42 degrees, that means 6 plus 36. I mean, body temperature is 36, so we need 6 degrees. With the radial fiber, we are able to maintain the temperature at the correct level to obtain 42 degrees without exceeding. If you remember the other picture, to obtain 6 degrees on the dermis, the temperature here was running up to 70, 80, 90 degrees. So to be able to stimulate the dermis, I pay a very high cost in damaging the subcutaneous layer. So this is how you optimize the use of the two fibers. With this one, I'm going to have a much better stimulation with lower amount of energy and lower temperature. Very good contraction because I can treat a larger area all at once, involving my subcutaneous septums for a longer part of the septum, obtaining a much better contraction. On the contrary, with the linear, with this high temperature, I risk to cut everything if I overtreat the patient, losing the possibility of contracting. Next one. Next. Next. So, two fibers. I will use next. One more. One more. So, with the linear, I have a faster coagulation and ablation. So I will use it in those areas where I want to remove fat, because I can have a selective lipolysis respecting all the surroundings. Then I can switch to radial in those areas where I need contraction and skin laxity improvement. Next one. We have a large variety of fibers, not only because of the emission, but also because of the caliber. Extremely thin fibers, 250 micron up to 600 micron, according to the indication and the area of the body you want to treat and the amount of energy you want to carry. Next. Next. To perform the procedure, we apply numbness. This is not only for the comfort of the patient, but also because water is a perfect carrier for this kind of wavelength. So a well-hydrated tissue is responding better with the laser, and also the more predictable flowing of the energy in the tissue will reduce the risk of burns and overeating. It has to be performed very superficial. It's a very dry, not local anesthesia. It's not a tumescence like you do for liposuction or ultrasound liposuction. It's very dry, very superficial, very small amount of solution. Next one. Now let's go in the most interesting part. The one we talk about the clinic, the protocols, how we select our patients. Basically, we have two main groups of patients, those patients that during the aging process develop hollowness, and patients that during the aging process develop hypertrophy and tissue lining. Here, of course, we don't need to do fat, but we need just key stimulation and contraction. Here, of course, we need to work on also on fat, on hypertrophy subcomponents. So we're gonna have a two-step procedure for singles and a three-step procedure for
انا
sevens.
محتاج منك حاجات كتير محتاج منك حاجات
Protocols for singles are first step contraction, and these are the settings that are recommended. And then second step rejuvenation, and this is the setting that is recommended. Next one. So this is a clinical example. This patient, sinker. This is what they performed, following the protocol, contraction, rejuvenation, radial fiber, because we said the radial fiber is the best for skin contraction, skin stimulation. And this is how you perform the contraction. You create vectors of contraction, single passes in order to obtain a subcutaneous network contraction for, centrifugal contraction and attraction of tissues. Second step, homogeneous stimulation of the skin in order to increase collagen and elastin. And this is the result. It's not only a matter of tightening and better definition of the jawline, but look at the quality of the skin. All patients treated with this procedure, respecting protocols, you will observe an improvement in skin quality and skin elasticity. This is due, as we saw before, because we improved, we increased collagen and elastin production. Second patients, we can refer to the Merck scale for the sadness. The best indication, of course, is up to class 2, but we can also treat class 3 and class 4, but we have to be aware that class 2 can be class 0, but if you are in class 3 or class 4, you can gain one class. So class 4 can be 3, 3 can be 2, but 3 cannot be 0. Why? Because in class 3 and class 4, muscles are involved, and we are not able to lift this mass in this procedure. This is partially true because actually on the neck we can contract with this mass because we see improvement of platysma, but this is not true for the face. Three-step procedure, we said. First step, fat developing, then subcutaneous sportation and skin rejuvenation. We said that this is a class 2 patient, so let's see how we can approach a patient like this. First step, we said, is fat debulking, where? Only where is needed. So in this case, the selected areas are the submandibular area in order to sculpt the jawline, because it's much easier if we sculpt this area instead of trying to lift all the cheek. So we remove the gliding tissue that is going over the mandible and reducing the mesolendial fat compartment. We use a stacking technique, so we just position the fiber where we need. We do stacking, we stack some shots of the laser in order to obtain an immediate reduction of tissue. For the submental area, we can use a perpendicular technique that provides pillars of adhesion, full thickness, that is very effective. We will show it in the video. There are some areas that should never be treated with fat debulking mode. And then, second step, tissue contraction. Same protocol, same setting. As I said, we grow in man the vectors that are strategic for the cheek contraction and then skin stimulation. Here we see how we perform the ablation of the undesired tissue. I reach my targeted area, and with the microfiber, with the laser, I start to delete micro area of fat. Why micro? Because we should not affect all the fat. We just have to remove that part of the fat components that is affecting the definition of the jawline. I reach the point, I give some shots, and you see immediately after the reduction in volume. You see the dimple, you see the groove where the laser has been working, and this is, as I said before, the pure surgical part, because here we are deleting tissue in a surgical way permanently. This is the second step, coarctation. These are the vectors. I'm using a radial fiber here, while before I was using the linear. I position my fiber and then retract, backward technique, making points of contraction. And you see here the immediate contraction of the malar area. All the cheeks is contracted upward, and we have an elevation of the zygomatic cutaneous ligament due to the thermal stimulation. It's an immediate result. Third step, skin stimulation, radial fiber, standardized protocol. I work very superficial in direct contact with the deep dermis in order to stimulate skin quality. The movements are faster in this stage, but we cover all the areas because there is no risk of affecting the fat. Results after 2 months. Next. And here we see a follow-up at 1 year. Stable, predictable results, always.
لسه والله كنت بشيل رجلي
Which is the end point when we work? This is another very frequent question. When should I stop? It's a matter of number. It's a matter of how many jewels I have to deliver. Or we have a clinical endpoint
وزار المحترم
that is more important.
خلاص كمان
Volume, skin elasticity, they should improve directly. Okay. They should improve immediately after the laser emission. So if we don't see an improvement, we have to change something. We have to do something wrong. So clinical evidence should show immediately. Next one. And here you see treated part and untreated. You see the pinch test is completely different. And also the pinch test for the submacular fat compartment, you see immediately the reduction in volume. Also here, testing elasticity, treated, untreated, treated, untreated. You see the difference in matter of elasticity, amount of tissue, and thickness. Next one. Next one. Next one. So let's see some patients now. This is an unsuccessful treatment. No result. Or she is even worse than she was before. That was my mistake. I used the wrong fiber for this indication, and the settings were not the correct one. It was not the correct one. So that was my mistake. Unsuccessful treatment. Next one. Class 3, becoming in class 2. In this case, 2 fibers, linear and radial, to optimize the lipolysis and tightening. Next one. All patients will see improvement in the quality of tissue. 1 year follow-up also in this case. Skin quality enhancement, fat compartment reduction, and contraction. Next one. Skin quality, tightening. Next one. Rejuvenation, tightening, and fat reduction. Once again, skin quality and tightening. One more, next. And this is very interesting case to be discussed. 84 years old. She asked me, can you do something? I can't do so much
بص الحاجة
regarding the lifting, but I can do a lot for rejuvenation. So even if we didn't lift totally,
في حد
but we
هناك كان
did
صار
rejuvenate
حاجة شبه كده.
tissues. Next one.
ظبطت؟
I have hundreds of excellent cases. So this is a procedure where you see immediately the result, you control it. It's not something that you apply and you have to hope
شبه
that you see
الفستق.
the difference. The difference is there already during the treatment. We did a live case today, and we could appreciate that there was immediate improvement in the morphology of the face. 1 year follow-up, next. 2 years follow-up, 3 years follow-up,
المفروض بقى هي
and 5 years follow-up. So, do you know any other medical procedure that in 30 minutes allow you to have a result that is still appreciable, still here after 5 years? Next slide. Just to conclude, I would like to announce that we are almost ready for a new protocol for the eyes. Next one. Next. It will be based on a classification where it has different degrees and different parameters involved, from wrinkles, laxity, and IBEX, and there will be standardized, personalized protocol for each indication. Next one. These protocols are based on
بص لي كده اللي هو انت
real clinical evidence. So we tested directly on tissues to prove and to be sure that the settings are effective in contracting the orbital septum and muscle remodeling and skin contraction. So all the parameters that will be provided are based on real evidence. Next one. Just to discuss a case, entry point, next, vectors that should be performed in different layers, and the results. Skin contraction, reduction in wrinkle, quality improvement, and eye back
لو في
reduction.
بيزنس
Next
كنت او
one.
الاسم بتاعك بس بالظبط
Lateral view, same patient. You see the elevation also of the lateral third of the eyebrow. Next one.
هي البيزنس
Eye bags, upper eyelid contraction,
موجودة
symmetrization of the two eyelids. Next one.
انت اكيد
This
هتنسيها
case is from Yaya, that she's doing this clinical study with me. You see the improvement not only in the eye bags, but the improvement of the action of the muscle of the orbitomolar ligament. Next one. And here skin quality, skin contraction, and high back reduction. Next one. This is just the 2 clicks. Is a symmetrization. I work here only on retaining network, only in the ligaments, to have a symmetrization of these two malar areas. It was not the periorbital area involved, not IBEX, but only this deformation that she had constitutional, but we really improved it a lot only with the laser. Next one. Also, we will provide you tips and tricks to avoid these kind of side effects in the periorbital area. Here the tissues are very attached to each other. The subcutaneous layer is very poor. We don't have fat in the bone. At least we have very poor fat in the subcutaneous layer. So it's a very sensitive area. The skin is very thin. So I've seen a lot of colleagues, unfortunately, to experience this. But it's very easy to avoid. We just need to improve manual skillness and use the correct parameters. I think we just go directly on the light laser. I know we don't have so much time. This is a scanner that is an handpiece for the laser. It's a fractional, non-ablative or minimal ablative laser. Next one. Next. This is a very easy protocol that can be performed. Next one. And here is the improvement in the skin quality. This is a fractional, so we do it from outside. It's a transcutaneous. Improve the elasticity and quality of the tissues. This kind of application is interesting because the time is really minimal. 48 hours of a little bit of redness and edema, but after 2 days you have total rehabilitation. Next one. Acne scars. Dr. Sakharin nice protocol for acne scars in combination with the exosomes. So last one, they told me to speed up the presentation. So of course we have indications also for body, same indication, skin laxity and mild to moderate adiposity. Next one. Next. Next. Very easy the application in different areas, especially those areas that also with surgery are a little bit tricky because difficult to do a liposuction in the inner thighs, like it's very difficult to do a liposuction for the ankles. Next. Next. Just scroll a little bit some before and after. Look at the, just go back, look at the quality of tissues after the laser action. Look at the vascular behavior. Look at the improvement of the quality of the subcutaneous layer. It's amazing. More than the liposculpting. Look, not treated and treated. You see the nice sculpting that you can achieve on the ankles. Next one. Next. Next. Just scroll the before and after. It's not a liposuction, of course, but it's a very interesting protocol procedure for body because what you reduce in matter of volume is permanent. There is a huge experience. I'm reporting here cases from operators from all over the world. Last application, very interesting. This is a surgical application. There is a dedicated end piece where you can insert the microfiber and connect the vacuum machine performing liposuction and laser lipolysis contemporary with the benefit of tightening and softening of the procedure because the laser opens the way to the cannula, so the effort that you have to apply to the cannula is very mild. Next one. Next. Here you see I am performing under local numbness here. The laser is inside the sucking cannula and you perform laser and liposuction all at once, combining the benefit of the liposuction and the laser itself, improving elasticity and skin contraction. Some results, of course, here with the surgical approach, the results are much more brilliant. Next. 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 So, this is the last. Why do we like this procedure? It's effective. The results are predictable, controllable, long-lasting. Incidence of side effect, extremely rare side effect, and all side effects are temporary. Joining point between surgery and medicine. This is actually the new field where all patients and doctors are exploring new procedures. The Laser 1500 is not only Edolith, but can be performed in different specialties, from plastic surgery to gynecology, proctology, vascular treatment. So it's a very versatile, multifunctional platform. Next one. So I thank you very much for your attention. Sorry for taking so much time.
Yes, thank you very much, Dr. Ricardo, for the great presentation and talk. Now we'll move to Dr. Lant Khatari. She she is a consultant, maxillofacial surgeon. And after that, we'll have the discussion with Dr. Ricardo if you have any question.
Thank you, Doctor. I'm so delighted to be with colleagues from different countries, different specialties. Actually, back home in Jordan, we don't have the device, and sometimes it's just been in Jordan for around 6 months. I've been working with the technology of laser device, laser assessment treatment with around a year. Actually, I want to just emphasize on Dr. Ricardo's point that the landscape of aesthetic practice is shaped and reshaped continuously by innovations that promise to give long-lasting results, rejuvenation, low risk, minimal complications away from surgery, and the potential complications that it might carry. From my opinion, intellect can bridge the gap between injectables and their limited potentials and low risk, and surgery with its more satisfying results but more complications. Our patients usually trust us, and they come, our loyal patients come trusting the process, trusting the doctors, but actually who always question is our colleagues. I always receive questions from my colleagues whether it's a trend or not. We have to dig into 3 factors in order to answer this question. Those are the history of the device, second, the mechanism of action, and third, the factors that make this device or this technology look like a hive. You can just get back to the slides, please. So when we talk about history of the device, it merged into the surface of the scene of aesthetic practice since 2005. This means that it's already explored, it has its own foundation, and it's supported by a huge body of clinical research and peer-reviewed articles that support its efficacy and its safety. I'll share some of my cases with you. This is a case for a patient who's been always treated for their jawline to camouflage the jaw areas using dermal fillers. We dissolved the filler, then we did 1 session of intellect with her, and this is the after photo, like after around 2 months. Next, Yusuf, please. Okay, this patient also came complaining from heaviness, and I think that all of us have such patients that come complaining from the lower face. And I've always been reluctant to treat those patients with fillers. I've always used biostimulators, and it's dropped actually the use of fillers for this application. But for me, the correct approach is to get rid from the problem and work from a baseline that might give the patient a better result without changing the ratios between the lower face and the middle face, and giving more refined treatment away from changing the vectors. Next, please. This patient actually, this is the immediately after, and I just want to tell you that my best results were the first cases when I was so scared from putting high settings, because the first device I had was with no settings, no preset settings, so I was so afraid of putting high temperature and high joules. After that, I was so excited, and I raised the settings, thinking that this will give me better results. But what I discovered, and I was self-taught actually, that less is more. You have to select your patients well, you have to know when to stop, and the amount of energy and the amount of heat that you have to deliver. Despite I always use a thermometer that can measure the surface temperature. This is immediately after. We can see the contracture. Here I started to develop my techniques a little bit more. This patient, we only worked on the submural area. Next, Yusuf. This is one of my cases for the under the eye. Actually super courageous to do it. She complained from the bags. Here I used the radial fiber, but it was a very low setting because it's very thin skin. I was afraid of any burns, any complications, and the aim was to contract the tissues to hold the fat back rather than dissolving the fat, since it's one of the very first cases of mine. Next, Yusuf. Now this is not a Photoshop. I just asked ChatGPT to change the background. This photo was sent by the patient. Okay, so it's 2 months after. What I experienced with such patients that I use ablation is that they hear from the surroundings that did you lose weight? So this is the first thing that my patients come and tell me after 2 months in the first session for such chubby or let's say heavy patients. Next, Lisa. This patient, I think this is one of my best cases because it was a challenge for me as a beginner to adjust how much heat and how much energy I will apply for each side to achieve symmetry. This is after 6 months. The top picture is after 6 months. Next, please. This is the same patient, but I think she needs a little bit of some refinement in the chin area. She has a microgenia, and I think she will benefit with some fillers in the chin. Next, please. Next. This is one of the most beautiful cases because I started to get better results after less time. This post-op photo is after only 1 month. Yes, yes. Same patient, and you can see the improvement with the malignant shadow. Next. Same patient. Next, please. This patient actually, I always show this case for my patients. I cover the top picture and ask them about the age of the patient in the top picture. And they say maybe she's 45. And after I show them the top picture, she's 65 actually. But getting rid of the heaviness in the lower face actually gave the patient an extra discount to her age around, like, for me it's 10 years. Next, please. Same page. This is another patient, but let's in this case, I was so cautious with the ablation. The aim was to improve quality and get some contraction more than getting rid of the valve. Next, please. Now, this is a surgical case. No judgment, please. I consulted the patient. I told her I can't do much with the intellect, and we will give it a try. And anyway, if you get laxity, we will go to surgery. So this photo was 1 month after first session, and I will do another session like after 2 months. Next, please. And here's the front view. Next. Now this is an interesting case. The patient, which photo looks gaining weight? It's the right one. But this is the after photo, and in this photo, after the treatment, she gained 10 kilograms. So despite gaining weight, she looks thinner and she looks more contoured in the after photo, and this was 6 months after. Next, please. This was minimal, and we aimed toward contraction and biostimulation. Next. And this is the side view. Next, please. Yes, sir. And this is the side view. We got some contraction with the biostimulation and a little bit of reducing the jaw area. Next. This was 2 months after. Next, please. This is the immediately after.
اصلا الدكاتره بتضايق
Next.
هنتكلم
Immediately after. Next, please. Actually, I need to show them the after yes, please. Next, please. Next. Next. This is one of the cases that were actually, you might think that this is the after, but actually this is the after. And this one of the failure cases is mine. I did not get any result. And I think I need to do another session for the patients, aiming to work more ablation at the jaw area, because we ended up with more sagging. Now we need more biostimulation and more ablation at the jaw area, the recombination. Next, please. Now this is an interesting case, and for me, when patients ask me, and please ask me, what are the contraindications? For me, the only contraindication, away from the which indications it's the expectations of the patient. And after the patient, you might get 10%, 20% improvement, and the patient accepts that this I might do this the treatment for. But if the patient has very high expectations, for me this is a contraindication. Yes, please. Same patient. I think it's a very nice result to like 4 grade going to around like 3 or maybe less. Yes, please, next. Now this is the patient that actually immediately after photos. This is after 1 month. Next, please.
ماشي.
Next. Next. Thank you. And this is my last case before I just came to Riyadh, and this is the immediately after photo. We can notice the profound contraction of the lower face. Next. Now this was sent by the patient. She lives overseas. We can see better definition for the double chin. That I think we would need another session for her. Thank you. And this is immediately after. This is the next one. Next. This is immediately after.
تخيلي بقى اسمه ما يمكن
Next.
لا اسمه ما يمكن اللي انا جايبه امبارح
Yes, thank you very much. Thank you very much, Dr. Ram, for the great informative presentation. Now, Dr. Rami Anani, plastic surgeon from Egypt, he will talk about lymphoma.
عملنا كده بمليون الدكتور على فكره بتاعها هو شايل
I will not take a long time. I know all are hungry, and I'm just going here to introduce for the at the end for the dinner. So just 5 minutes. They just telling me at the end of yesterday night. So are some cases of your injection with the hyaluronic acid together with the calcium hydroxide. Okay, so go next, please. It's not a talk, it's just like 10 slides. Okay, so it's just before and after of some photos. Look, it was, and I will give you like a very short history about, I thought about this mixing with the hyaluronic acid together with the calcium, like from 10 years. So when I was there with another company, which is also a respectable company of calcium, so I used this calcium together with hyaluronic acid like 10 years. So it started like in 2015, next. In 2017, we were there introducing this in Barcelona, next. And then in Lebanon, then in Tunisia. Then it was in Incas in France, next. So short slides about its calcium and hyaluronic acid, either with both of them have its own characteristics. This is for new collagenesis and the other for hydration. This is for targeting, this is for revising. Next. This is the two, next. This is the two patterns of calcium hydroxy. Okay, to take it shortly, to introduce like 10 cases of mine, the hyaluronic acid, I will take it like an example because it's different companies with different concentrations, hyaluronic acid and the cross-linking. So in the next, back. Then in the next few slides of my cases, the pattern, I will use it through mixing the hyaluronic acid with the calcium. We use 4 patterns of hyaluronic acid, starting from the highest concentration of hyaluronic acid together with highest density of the cross-linking, getting it gradually to reach the pattern 1. So when I'm using the next mixing the calcium with hyaluronic acid, next. So it would be like, the calcium hydroxide type are going to be like pillars, and the hyaluronic acid particles would be like stones in between. So we are built up like a building. Next. So it's like, it's cool and scheduled to be longitudinally in the article. So the calcium with the pattern of hyaluronic acid with different concentrations is going to be later published, but I will talk it like first. Okay, next. Please don't take a photos because it's a real patients. I didn't take a consent from them. It will pass quite rapidly. Okay, next. Okay, play.
بجد يعني بسرعه عشان تورينا صور مفروض.
Okay, this is a case of mixing calcium with a pattern. Look, we don't want too much volume. We introduce like pattern 3 and pattern 1 of hyaluronic acid next. Together. Also, this is a pattern 3 hyaluronic acid, and pattern 1 together with the calcium hydroxide type, we'll see some sort of, it's immediately after injection. Next. This is also case with the pattern 3 and pattern 1. Again, just for tightening without making too much volume. Also make the skin light, brighter and rejuvenated. Next. This case also, we don't want any look. It's a plumpy face with this wrinkle. So we want it tighter without introducing more volume. So it's pattern 3 and 2. Next. And also this patient without any volumizing effect, it's pattern 3 and pattern 1. Together with the calcium, again. Next. This has some sort of pattern 4 and pattern 1. We want this lumpy, see what her request to do some cheekbone to be more augmented with tightening, with increasing the pattern of the skin quality. Next. This patient pattern 2 and pattern 1, just no 3, no 4, no high concentration of hyaluronic acid. Next. This also for pattern 2 and 1 together with the calcium. Again, next. This is with pattern 4 and pattern 1. You can see the cheeks looks lumpy, rejuvenated skin. Next. This case, it was really challenging because this depression is here with the attachment of the ligaments. It's really challenging. When you are injecting it sometimes, you can see it's become more aggravated. So the way of injection for me was by two-way, injection deep and superficial with some sort of subcision with a pattern of 4 and 2 hyaluronic acid together with the calcium. Again, next. Oh, this is just 2 and 1 pattern with the calcium hydroxide tight. Play. Next. No, back please. Yeah. Okay. Back 2 times and 1 time forward. Yeah. Okay. Yes. No. Go back 1 and go forward. Yes. Which one? That's it. Yes. You can see better with the front cheekbone and the jaw angle with a very, look, a lot of patients for my practice, they want it to be natural. Of course, in our region, you can see different, they want it too much, but it's not my way. If she asks me for something, I go for another doctor because at the end, it's my case. Okay, next. This is also male in our countries, all males, when they are trying to inject filler, which is not too much patients, male who are going to inject, they want to be very natural. So for him was calcium together with pattern 2 and pattern 1 hyaluronic acid. Next. Okay, play. Yes, next. What's that conversation here? Okay, for this patient, you want to look natural, but you want a well-defined cheekbone with the angle of the jawline. You can see it's pattern 3 and pattern 1 hyaluronic acid together with the calcium hydroxide type. Next. This case was a very challenging one because I introduced 3 patterns of hyaluronic acid together with the calcium hydroxide types. The way of injection was there, not just sharp technique, because I like the sharp technique. I know Yanni, he is fond of all the cannula. He's cannula. I like, of course, the cannula. But in such cases, I introduced both. Of course, for all these wrinkles, I make like a huge subcisions of the microcannula with the injection. My way when I'm mixing the hyaluronic acid with the calcium hydroxide, of course, thanks for the Calhydra, which introduced really in the last year, Calhydra and Calhydra lifts. With the I use both. I use the Calhydra lift for my face. It's really very nice. You shortened my experience in the mixing technique, but in my ways, I bring the Nuvoma. Then I brought hyaluronic acid, whatever the comments, I used your comments of course, for concentration of hyaluronic acid, density, and cross-linking. So I defined, according to my plan at the beginning, for this patient, I used 3 concentrations, 3, 2, 1. Then I divided the calcium hydroxide tight amount with the hyaluronic acid amount among all the calcium, and then start for the superficial wrinkles, introduced firstly with the pattern 1, then the pattern 2, then all over the face with the pattern 3. Of course, you can see it's really dramatic results. Next, please. Why do you do it 2 times at the time? Yes. Okay. Then, okay, next. Through the mixing technique, the calcium, the framework acts like a pillars, while the hyaluronic acid acts like stone that breaks the building of the tissue strong and sustainable. The way of mixing has a cause and scale that will be published soon. For over decades of mixing experience, I can say the novel way of injections over the main features, natural look, through merging, volumizing effect with the stimulatory effect, improving skin quality. The patients look even better after fillers fading out. It's really all the patients say it's for me. Before using the hyaluronic acid, it's a very nice filler, of course. But when introducing the calcium, let's imagine it was like from 10 or 11 years before, when the first time they brought for me the calcium, I was really afraid about this filler because, okay, hyaluronic acid, it can be dissolved, but the calcium, it's not dissolved. So when I introduce it, I see it's really inert. It's required no skin test even. So it's very safe if you are thinking probably. So, provide a long-lasting effect and longevity. Next. Okay, thank you. Next. Just I want you really to know about this event. It's a grand fest. It will be held soon after the next month. It will be the first time and ever, not just in the country region, all over the globe, to merge in between science and entertainment. It will be over the sea. There will gonna be the theater over the sea, the glass rooms, the balls, the session will gonna be in the rooms, and also at the night festival all over night, three nights, and you can search it through the social media. If you want to join, we'll be there. Thank you so much, sir. Yes, sorry, it's a very important issue. I go here also for this. This is the first reason. For Dr. Ricardo and Dr. Yanni. So let me, Dr. Ricardo. Yes, it's a very small gift from here, the country and the company. Sorry. Let me introduce my beloved idol, Dr. Yanni. It really gives me always pleasure seeing you in the same month, even 2 times in different countries. Thank you so much. You're always welcome.
Thank you, Rami.
Thank you so much.
Everybody say Nuvuma. Alright, guys. Thank you so much.
Yeah.
طب اوكي روحي شوفي هذه افتحي الشنط وافتحي معاها صعب والله العظيم الصور انت هتسوي لهم شي تعديلات؟ طيب خلاص عطي عليهم متى يناسبك جهزوا لي غير حتى شي هذيك الفلاش روحي زبطيهم حطيهم على الفلاشة بمرض اخذوا من الفلاشة فيها كل الضغط ايه يعني حال انك ايه طيب هي دي بكي هذا اسمعي هي she look for the cover of lens she's looking for the cover of lens two she need two which chair قد حطيتهم على كرسي قد حطيتهم على كرسي سيري شوفي الكراسي والله جربت الكراسي شوفي بني واحد موبايل هي في الطاولة من هناك شوفي خلف العلم خلصوا بسرعة والله خلاص أنا قاعدة نسيت من حاجة أنا قاعدة والله يلا We go for dinner and we back for the stuff. ولا we date. No, أنت تاكل ها؟ No, buffet هذا. Same last time. He will go. How I did today? Huh? Really? How I did today? Good. Better than last time. I think it like class. I know I. Huh? What's he doing? No, you cannot. Jimmy, flash حقي. She has my flash. cover حق لازم.
عايز كله مش عامل لا بص الله بارك لك هجيب لك 5 معانا لا يا باشا فين كان هنا مش يا عم رحتوني هو انا قاعد هنا الا دكتور ولا ايه؟ كده يا دكتور انا عارف اللي انت دماغك مجنونه دلوقتي
يكون في الحمام. لا ما حصلتي؟ ما حصل يا الله يا الله معلش صبري معك يلا يا حبيبي لازم نعرفها شويه بحاول احنا نحمل ونحاول اس شوفي هذول حاجات عمر مثلا شوف كنت حلو صور يلا يلا يا حبيبي بس ليش بنشوف شيء بسيط راح يلا تصور في سيارة دقيقة
مطعم اسمه
نحب نصور نحب نقول له وكر